What's the worst experience you've had at the doctor's? Cut my hand while making dinner one night and needed stitches. My boyfriend drove me to emergency, and the nurses made me wait in a solitary side room because all of the blood on me was scaring children. Well, I was supposed to be fast-tracked because the bleeding wouldn't stop. Fast forward almost 4 hours later, and I came out and said, "Hey, if I go to the bathroom and someone calls my name, will I still be able to go in after?" They were shocked. "OMG, you're still here?" They forgot about me. I was covered in blood. Bleeding through my bandage they gave me as I walked in. And they forgot about me in this dark, quiet room. I had a miscarriage and he told me to not think about it, not worry about it, and ignore that it happened. I went home in shock and just fell apart hard. I too had a missed miscarriage. It is where the fetus dies, but is not expelled naturally. I had a checkup ultrasound, I just had some light spotting but wanted to be sure, where the first words from the doctor were, "It is dead. No sorry for your loss or anything," and then she starts to go on and on about how the baby will be removed. I was in shock and had not yet fully realized it, so I asked if she was really certain. She gets angry at me and turns the ultrascreen towards me and screams something in the lines of, "Yes, I am. Check yourself. There is the baby on the screen with no heartbeat or movement." I start crying like a madwoman and she just looks at me for a few minutes and asks, "Do you have something wrong with you?" "Yes, I have. There is a dead baby inside of me." But I could not say it, so I just kept on crying. She looks at me for a while and then calls a nurse. The first thing the nurse says is, "I am so sorry for your loss." I had to stay at the hospital to give birth with the help of medications. Everyone else, nurses and midwives, were so kind and nice. Still makes me mad. I understand it is just a part of a job for her, but no drop of human emotion or sympathy. In recovery the day after having an emergency C-section, my Aunt A adopted him. She was also my support person during my stay. We'd discussed prior about breastfeeding/pumping, and I opted not to do it either as I didn't feel comfortable doing so. She was okay with this. It's put into my chart that I am opting out of having a lactation consult because it's not needed. A lactation consultant enters the room immediately after lunch is brought it. At this point, between labor pains making me nauseous and the anesthesia from the surgery, C-section plus tubal ligation, I haven't eaten anything in about a day and a half. I am hungry and cranky and very much do not want to be here. Nurses were great. But I'm autistic and everything going on sent me into a week-long sensory overload. This nurse enters the room with a very loud, "Hey mama, how we are doing today?" She then proceeds to take the food tray from me, abruptly forcing the bed, and me, from its upright position to an almost flat one and pull down the top of my gown. I was in the room closest to the nurse's station and the door was wide open. She makes a comment on how lucky I am to not be leaking, says that she's going to show me how to help your flow out a little, then grabs and squeezes me. Of course, my immediate reaction is to slap her as hard as I can. Ended up ripping out my 4 in the process. Needle phobia plus meltdown is not a fun time for anyone within a 50-foot radius. We ended up filing a formal complaint about her. Not sure what happened with it, but hopefully she at least got trained in reading patient charts and respecting boundaries. Scared to know. She isn't the first doctor who did that to me. She was just the most serious case. I had an endocrinologist and a general physician tell me the same. I've had nurses refuse me, and also a phlebotomist. It's happened to me a lot, because I'm in hospitals and other places of care, quite a bit due to my health. I suppose it's a luck of the draw, and when you see that many people you get some bad apples. But I am definitely hesitant to tell anyone now unless it has to do with reproductive health. I know they need to know, because for sure things like a heart attack presents differently in females and males and whatnot. I really don't know what to do due to fear. I even recently had my current general physician attempt to transfer all of my care, without my consent, to a transgender clinic after I came out to her. That was less than a year ago. She eventually stopped attempting after I told her I couldn't get anyone from the clinic on the phone and was like, please don't do this to me. I need a doctor to monitor my health, or I might die. Being trans has nothing to do with your care of me. You didn't even know for 2 years before I told you. And gynos, forget about it. As soon as I tell them, it's all they'll talk about. Don't you want to be a mom in the future? Blah blah blah. I can't stand them. And endos just want to talk about hormones with me after I tell them, like some NPC in a video game who won't stop saying the same line. I'm like, I have a hormone disorder. I don't think I want to piss it off with more hormones, thanks. But they won't take no for an answer, saying I'm not really trans if I'm not on hormones. I don't want it anywhere near my care. When I was 22, 25 now, I went to the ER for some pretty serious bleeding from the old baby-making factory. There was a lot of blood. I was going through 2 double-stacked pads in an hour. OB/GYN wanted me in the ER as soon as I called. I had a male doctor. I am not against having a male help me in when I am in need, but this guy. He looked me dead in the face and said, I'm a war doctor. I know nothing about that. He sent me home because a little blood can look like a lot of blood when coming from down there. He wouldn't say the word. I ended up in the OB/GYN's office the next day where they said I needed surgery and a blood transfusion. I, F19, went to the gynecologist because I didn't have my period for over half a year and there was absolutely no possibility for me to be pregnant. So, after the first examination, she drew some blood to find out what's wrong. When I came back for my results, she told me that I would most likely never be able to get pregnant, because I lack some kind of hormone. And the only chance I might have been to take a pill that is so strong that even fully grown adults are only allowed a max of 2 half pills a week, so for example 1 half on Monday, the other on Thursday, because the possible side effects are extremely severe. Plus, I would definitely get headaches, high blood pressure, and nausea from taking them, and it was right in the exam season, so yay. The problem, normally you draw blood in the morning, because of stress, and before you have eaten anything. She drew my blood on a school day in the afternoon, I think it was around 3 p.m., and of course, right after lunch. She also did not tell me not to eat anything beforehand. Lucky I went to a hormone specialist before taking the pills. And she did the blood draw properly. She told me that I was infected with normal levels of this specific hormone, and I actually have an illness called PROS, which is fairly common. Not happy about that either, but at least I can still get pregnant if I choose so, and there is no need for potentially dangerous pills. P.S. The hormone specialists also told me that if I had taken the pills it could have actually gotten extremely sick. So yes, not going to that gynecologist again, smiley face. A nutritionist was angry at me because she gave me a diet that I followed, and I only lost half a pound after a month and ignored any question I had before leaving her room. Went to another doctor and turned out I have hypothyroidism. A girl in a group recommended a gynecologist that did her tubal ligation without problems, but when I asked for the same surgery, he stared at me and pointed out I'm single and I should talk about it with my future couple. My body doesn't belong to an imaginary man. Now I'm with an amazing gynecologist, and while he doesn't do tubal ligation, he told me he would be the reference in the future when I can afford the surgery. I told my therapist during COVID that the antidepressants she put me on were making my depression worse, and that I wanted to know if I could discontinue them. She knew my husband, now deceased, was on chemo, and that I was uncomfortable going anywhere in person. We were in the height of the pandemic. I assured her that I was not at risk for self-harm. She hung up on me mid-appointment, and 10 minutes later, the police were at my door informing me that if I didn't want to go with them to the emergency room, I would be taken by force. While I was there, I was having a constant panic attack because I was so afraid of bringing germs home to him, and the ER didn't have non-oral thermometers. Also, I had to report an EMT for groping a very non-consenting nurse. To top it all off, I later discovered through a new DR that I never had depression to begin with. I have ADHD and ASD, which is why antidepressants never worked. Went to the ER because I was pregnant and living in a really bad abusive situation. I had gotten black mold poisoning because of the environment I was being forced to live in. I was so sick I couldn't keep anything down and was severely dehydrated from not being able to keep water down for a couple of days. When I got to the hospital, the nurse I was assigned to was immediately very nasty. She berated me for getting pregnant while also being epileptic. I guess in her eyes epileptics can't have children, which immediately made me feel painful. She wouldn't give me a blanket or sheet, but everyone else in the ER got one. They gave me 2 full 4 bags of fluids and 64 ounces of water and wanted me to hold my pee for over 4 hours while they waited for the ultrasound tech to come in. This is impossible for a normal person, let alone a pregnant woman. I got to the point where I was starting to pee my pants and was literally crying and begging them to let me go to the bathroom. I told them I would guzzle a bunch more water when the ultrasound tech was close/got there. It doesn't take long for water to go through your system. The nurse refused, but the doctor I flagged down let me go, and while I was peeing the ultrasound tech showed up and I heard my nurse shout for all to hear, all the doctors, nurses, and patients in the ER, that I was a giant baby who didn't know how to hold her pee. I just hid in the bathroom and cried my eyes out. On the way up for the ultrasound, this nurse got my 4-line caught on a door and ripped it out. Then when I was finally able to leave, she ripped my 4-line out again rather roughly and then walked out of the room. I started gushing blood everywhere and had to run into the hallway and flag down a doctor to help me with blood rushing down my arm and pooling on the floor. Then finally I was released, and the nurse wouldn't give me a note that I needed for work. To this day, I still have a lot of anxiety anytime I go to a doctor, especially now that I am pregnant again and have to give urine samples at visits. I have like mini panic attacks remembering that ER visit or panicking that I won't be able to pee in the cup. Had almost bled out during a miscarriage. 6 months later, I got pregnant again, and a doctor decided the best way to demonstrate to me that my labor would be elevated risk because of my bleeding tendencies was to turn on a water tap on at high volume. Being in shock and still working through my trauma from 6 months before, I didn't say more during that consultation. Just nodded and pictured all the blood coming from the tap instead of water. I nearly passed out at work and was taken to hospital. The doctor slapped me on my lower back, and since I didn't scream in pain, she decided there's no way it was kidney stones and sent me on my way. Went to another hospital in the middle of the night a week later, throwing up everywhere, writhing in pain and begging for help. The front desk told me they were going to call security if I didn't stop asking for help, and told me to go lay down on the waiting room floor and refused to get me a doctor. After about an hour of the worst pain in my life, they let me back, but refused to do anything to help me, and sent me home. A couple of days later, I convinced a doctor to give me a CT scan, but they wouldn't do a urine analysis to check for infection. Turns out I had 5 millimeters kidney stone. They refused to prescribe me anything to help the stone pass, and also refused me any pain meds. Another week passed, and my husband forced me to go back to the hospital against my will. I wasn't able to eat, drink, or stand up, and was white as a ghost and had a high fever and could barely talk. I had developed an infection in my kidney, and it was blocked in by a stone that wasn't moving. I was dying. They finally prescribed me something to pass the stone and pumped me full of antibiotics, and within days the stone had passed, and the infection was gone, and I was back to normal soon after. Waiting for 5 hours just to get a new axe for birth control pills, only to be nearly locked in the clinic at closing because they forgot about me. The nurse screamed at me, called the DR, screamed at him, and then threw, with a lot of force, about 6 packs of birth control pills at my face while screaming at me to get out. The surgeon who agreed to sterilize me at my request, but only because she felt the mentally ill shouldn't be allowed to reproduce. The time I had horrible pelvic pain for days that just kept getting worse, and the nurse did a urine test to see if I had a UTI, which came back negative. The DR then stood out in the hallway, did not examine me in any way, asked me what drugs I wanted, and then prescribed me an antibiotic which, when paired with my psych meds, would probably cause me to have a stroke. In hindsight, I'm fairly sure it was an ovarian cyst. I needed to find a new OBGYN, as mine had retired. I was 3 months pregnant with our second child. In the exam room it was just me and the dry, no nurse. He then proceeded to tell me what a great bush I had and played with it for several minutes. Then he brought out the scapula and got a hard-on. Please remember this was the early 1980s. Bushes were important, and women asked for assault. I ran out of the dry office and said bill me. I then drove away, parked in a Taco Bell parking lot, and sobbed I found a good GYNO, had our baby, then told my husband what happened. Again, exceedingly early 1980s. Male resident wouldn't make eye contact with me. Every question I asked he responded to my husband like I hadn't even spoken. Afterwards I heard the female doctor telling the resident outside that I had heartburn and first-time moms don't know what they're feeling. Yes, no, it was gallstones, and I actually ended up in the ER a few days after my daughter was born and had to have emergency gallbladder surgery. I have inverted nipples that rarely come out. Pre-delivery multiple nursing prep classes determined I could pump but not breastfeed given the baby would not be able to latch on. This was entered into my file. At 11 p.m. after delivering a 10-pound baby boy via a C-section at 6 a.m. enter the lactation nurse waking both my son and me to have me attempt breastfeeding. I flat out tell her it's not happening. She insists. She's pulling at my gown, has my son forcing him to my breast whiles guilting me about giving up without trying. After both my son and I began crying, I literally yelled, "Get out of here now. Do not touch my son. Get out now." No one could understand or explain why she had shown up at 11 p.m. to have me attempt breastfeeding when it was all over my chart it was not happening. Literally almost ruined my first night as a mom. Having the same procedure done 3 times on my face by one doctor. Third time the local anesthesia didn't work, so I felt the scalpel and all the cutting near my eye. It got infected and I almost lost my sight. Had to get a second opinion due to the infection being so bad that doctor was mortified and put me to sleep for surgery. No problems after that, and he said that surgery should have never been done while awake. News to me. The original doctor ended up being sued by several clients for fraud, and he lost his license less than a year after botching my face. I've been offered plastic surgery by the last doctor to clean up all the scar tissue, but it makes me who I am and adds character. I was inpatient at a well-known children's hospital when I was about 4. Late one night there was a kid in the bed next to me who started crying for his mom. I'd been doing okay until this point, but it set me off crying too. A nurse came into the room and yelled at us to both stop crying, or she'd give us something to really cry about. Still gives me PTSD to this day as an adult when I think about it. I was pretty drunk one night as went to the emergency room to get stitches after cutting my hand open on broken glass. The doctor in training, resident? Intern? I don't know the term, was tasked with stitching my hand, but she had to wait for the senior doctor on duty to inspect the job first after she was done. Twice the doctor said nope, no good, and made her redo it before the senior doctor got annoyed enough to do it himself the third time. The poor young doctor was so down about it. I was entirely too wasted to feel any pain and just told her to keep her chin up. When I went to a GI doctor and was told to lose weight and stop smoking crack to help my constant abdominal cramping, among other symptoms. Never smoked crack in my life, and I was at a perfect weight for my height. Saw a different doctor at another GI practice several weeks later, had a colonoscopy done, and found out I have ulcerative colitis that was affecting my whole colon. Being turned away for leukemia care due to the doctor's personal religious opinion about treating trans people. Oh, you're different inside, too. How can I treat you? I had no idea my blood wasn't human, lady. I reported her and the office gave her the smackdown, but I thought I was going to die. Dentist, but maybe it still counts. I was a child, and afraid of gas since my old-fashioned grandparents told me it kills your brain, so when I was having a tooth emergency extracted, I breathed through my nose when they put it over my mouth, and just nodded when they asked if I was breathing it properly. They then extracted the tooth without any anesthesia. It cracked and had to be drilled out the rest of the way. I still remember the building and walls having cheery balloons and such. I probably will forever. Wisdom tooth extract. And, for expense's sake, I opted for no nitrous oxide at first. Just had Novocaine injected at the start. The tooth was really wedged in there, and the dentist was using all his strength to pull it out. Despite the injection, I was shaking in pain. The dentist was wiping sweat from his brow. Eventually, I took the nitrous option. January 10th. So, when I was around November 12th, I had an accidental water slide, and I had to almost a full week until I convinced my parents it was serious enough. Then, when I finally got to the hospital, the orthopedist that handled my case just made jokes about it, said that I wouldn't be hurt if I knew how to behave and that I had it coming. I was so ashamed of that moment. There were around 6 interns in the room with us, and they've all laughed at my face instead of doing their jobs. Long story short, my back still hurts, and I can't be sitting for too long or the pain gets excruciating, and I can't breathe. Had major surgery right before COVID, was in the hospital for 3 days. Day 1 and part of day 2 were uncomfortable, but fine. Afternoon through night of day 2 was miserable. They moved me from a solo room to one with a roommate because of a bad flu going around. I'm convinced it was the start of COVID. It was right before Thanksgiving, so I knew if I didn't get out on day 3, I would be stuck for 2 to 3 more days. Well, I got out right by the door, which the nurses never allowed to close. The hall lights remained on. My roommate snored and had people there late, and the nurses were supposed to check on my progress through the night and never did until 4 a.m. The good nurses came in around 6 out of 6:30 and found out the previous nurses hadn't been checking and got concerned. Then my doctor came in and looked everything over. Yes, God bless that man for coming in at 7 a.m. the day before Thanksgiving. He goes, "Why hasn't he eaten?" The nurses, confused, said, "I don't know." He looks at me, "Why haven't you eaten in 3 days?" Me, completely unaware I was able to, said, "Well, no one mentioned it or brought anything." Well, the doctor had a meltdown. Apparently, he left instructions for what I could eat each day, and at the end of day 2, I was supposed to have a full meal. Never happened. Then he checked the nurse's notes, and flipped out they haven't been checking on me. By then I was pacing the hall, trying to convince him I could handle going home. He then asked when I got up and started doing that. I said had been up all night because of the circumstances, and had been moving around for almost an hour now. He looked at me and said, "You didn't have the progress I wanted to see, but you're clearly better off at home than here." And I had to leave an hour later. 18, was having surgery for my heart palpitations/murmur. They said I was to be asleep the whole time. Midway through I woke and saw nothing but bright lights and massive amounts of soaked bandages with blood. I started freaking out till the doctor realized I was awake. Then they put me back into anesthesia as I said, "Oh what?" Felt like I was in an abduction. I took omeprazole for the first time. My face, tongue and neck swelled. I took Benadryl and waited for urgent care to open. The doctor told me that people aren't allergic to omeprazole and that the reason for the swelling was strep throat. Later that day, the strep test came back negative. "You are the judge, but I think I'm allergic to omeprazole." I was a patient in the hospital a few years back. At the risk of getting graphic, I was hemorrhaging out of my lady bits. My nurse scarcely checked on me and told the doctor my bleeding was subsiding as the tech was telling her my bleeding was not subsiding. At one point, I called the front desk of the unit, and the charge nurse told me, "We expect you not to be feeling well." My normal resting pulse was in the 50s, and at that point it was in the 150s, triple my norm. One of the docs rounded on me, saying she'd been waiting for blood test results. The nurse hadn't drawn them. They were over 2 hours overdue, and had been ordered to start. Doc took one look at me, walked out of the room and called the OR. I had an emergency DNC. They took blood on my way to the OR, and my hemoglobin resulted at 4.6. 1/3 normal. I had had 4 transfusions at that point, so all the blood in my body was someone else's. Well, in the span of 2 years, a single medical system has misdiagnosed me at least 5 times. I've had 7 vials of blood lost, serious contagious health results hidden from me, given me 2 unnecessary operations, had 2-week-long hospital stays with no correct diagnosis, sent me to 3 wrong doctors, been talked over, disrespected, dismissed and disregarded, had doctors wrongly tell me they were going to operate on me with no warning whatsoever, been given medication I was allergic to, and been told that all my problems would go away if I simply lost weight. And 2 years later, no answers. I went to the emergency room after hurting my foot. Had x-rays taken, and the doctor tells me it's just sprained, so I leave. The pain is getting worse. Days later I go back, a different doctor x-rays it and tells me it is broken. Not only that, but it began to heal misaligned, so they would have to re-break it to set the bone properly or leave it as is and deal with the early onset arthritis later. It was left as is, but I'm not sure if I made the right decision, lol, time will tell. My doctor was out of town and my kid was sick. We've had colds and other bugs on a regular basis, but this was unlike anything else. Went to the walk-in and the doctor didn't even listen to her chest. He told me I was overreacting, and it was a cold. He said to go home. I was in the car and decided to turn towards the hospital instead of home. ER doc listened to her chest and heard the popcorn sound. For antibiotics and almost a 2-week hospital stay. We almost lost her to pneumonia, and if we had gone home, we probably would have. Had to have a nasogastric tube inserted after major abdominal surgery. I knew something was up when my nurse came into my room carrying a bucket full of tubing, and she brought the charge nurse with her to help with the procedure. He was built like a linebacker. It felt like I was choking and drowned while vomiting my guts out, all at the same time. I was psychologically wrecked for days after that. Most insulting was when a doctor I was getting a sports physical doubted my ability to play the sport I'd been doing for 4 years because of my disability, despite my disability advocate being my coach. Mine isn't nearly as bad as most of y'all's. New Year's week 2019, I got hit hard with some bug. I lost 8 pounds in a week. Mom was adamant that I go see a doctor. I really didn't want to because I have no insurance. I go to the doctor, wait an hour, the doctor gets there and does a nasal swab. Wait another 45 minutes for the results, only to be told it was nothing and here's some amoxicillin. They billed me $350 and let me go. I thought that was the end of it. 2 weeks later, they bill me for another $2,000. I called and got it down to $300, but it was just ridiculous that they wanted that from me. This healthcare system is beyond a joke. I had an ear infection, and it came to a point where it literally hurt to even hear. I also couldn't touch my ear that much because it would feel like a knife stab. We went to the doctor's, and he refused to take my pain seriously. The nurse even said she could clearly see redness in my ear. But from what I recall, the doctor kept saying I would be fine and that I could handle the pain, when it was literally making every single day miserable. I also feel his reasoning was racially motivated though. I'm 99% sure I heard him say, "Your people" once. Nonetheless, it took my mom getting angry and raising her voice for him to give us some sort of medication. And when we returned for another visit, yearly checkup, a doctor told us he had given us the weakest medication there was, and that he could have given us other medication that would have helped a lot faster. I'm fairly sure it took about a week and a half for it to go away with the medication he assigned. I was diagnosed with epilepsy. 3 years before that, I kept telling them I thought I had it. They ignored it as I was an ignorant child back then and just gave me a packet about watching me when swimming, etc. I received the same dang packet when I was officially diagnosed, only this time, 3 years later, they finally said, "Hey, this kid might have a problem." Mine's definitely not as bad as some of these, but when I was like 10 I was dehydrated and had to go to the doctor about it because I started feeling pretty bad, and they decided to draw my blood to do some extra tests. When they were doing it, they kept poking my arm with a needle, but because I was dehydrated, my veins weren't really visible or whatever, so they couldn't draw blood. They stabbed me with the needle about 9 times in one arm before trying the other one, and at that point they thought they should see if they had anything smaller, which they did not. They then poked my other arm about 5 times before thankfully they were able to get blood, and ever since I've been a mess every time I have to get my blood taken. The stupid doctor told me I have scabies. Turns out I just had bed bugs. I even caught a bed bug and gave it to her in a plastic bag. She insisted I had both. Nope, it was just bed bugs. I went for a second opinion and that doc was shaking his head asking, how did she come up with scabies? Look up scabies and see. The bites look quite different to bed bugs. The jerk didn't even get within 10 feet to examine the bites. Anyway, stay away from Dr. Frew at Modern Dermatology PLLC. Walked into my GP's office and asked about the pain I was having in my jaw. She disregarded it as just anxiety. Around 2 years later, I had to be hospitalized because the pain had become chronic. Turns out I have TMD. Not really in the mood to explain, so here's a link to the NHS. My depression and anxiety were getting worse. I was on the same meds for a long time and after a while they needed to be changed. On the verge on suicide, and my doctor told me to order a book off of Amazon. Super unprofessional, and he downplayed my spiraling mental health. Needless to say, I saw a psychiatrist and the result and bumping up my dosage saved my life. I was having a ton of back pain. I had a feeling it was due to my bed, but I went in, and my doctor immediately tried to sell me on a standing desk. He completely disregarded my experience and literally started sending me Amazon links to various desks while we were talking. He straight up turned into a salesperson. A little while later I moved and got a new bed. Guess what? No more back pain. The doctor attempted to do a pap smear, couldn't get more than half her finger inside, stopped the entire appointment without doing anything else, not even the breast exam, and shamed me for being too tight and sensitive before leaving the room. I had to pick up a prescription for vitamin D afterwards, and I just sat in the pharmacy bathroom and cried a little. It was my last appointment before losing my insurance upon turning 26. I needed a cervical biopsy. You may feel a little pinch. They had to virtually peel me off the ceiling. I was screaming in pain. Apparently lots of women go through this. Doctors don't seem to believe that lopping off a piece of our lady parts might hurt like a mofo. If I ever need this again, I'm insisting on anesthesia. My back went out a couple of years ago. I was in constant pain, couldn't stand up straight and had trouble walking. It was the weekend, so I was waiting for Monday to get into a chiropractor, but I couldn't wait anymore. On a Saturday night, I drove myself to the ER to see if anything could be done. I slowly hobbled inside, and they took me back to a room. A doctor came in, told him what was happening. Right away, he said he wouldn't x-ray me, red flag, and that it was probably my muscles being tight. So, he gave me a shot to relax my muscles. Came back 30 minutes later and asked how I felt. I told him, I feel exactly the same. He left again, eventually came back, and told me I was free to go. He didn't seem concerned. It was a waste of time, helped nothing, and I ended up getting a bill for $2,000, plus after insurance. Ended up getting into the chiropractor a couple of days later. X-rays and tests. Plenty of issues he found and thankfully resolved over the next few months. I am very phobic of needles and needed to get a blood test done. I brought my mom for support as I was very anxious. As the doctor went to put the needle in, my mom pinned me down, resulting in me passing out. It's made my phobia worse as now I need to take anxiety medication before having vaccines and faint often when I have to have them done. I haven't attempted a blood test since. Ended up having to have a partially emerged wisdom tooth removed with almost no numbing. Something about the way it was sitting left no tissue close enough that would take more than a drop or two of the numbing shot. I could feel the doc inject, and then my gums basically leaking all of it back down my throat. Also was my own driver, since I had a wisdom tooth taken out by them before and felt nothing, so I couldn't get gas or even a mild Valium. After many attempts at injections, I gave him the nod to just get it over with. Poor guy looked as uncomfortable as I was. But he wasn't. That was up there as one of the most painful things I've ever experienced. And I remember how drained I was on the way home. Pure exhaustion. When I was like 6 or 7, I had to get like 3 different shots, and I remember being really scared and freaking out, so my mom and 3 other doctors had to hold down my legs and arms while a nurse gave me the shots. Probably the most absurd experience was when I went in with excruciating chest pain. The doctor downplayed it and sent me home with a prescription for a colonoscopy prep drink, thinking I was constipated and just needed to clean my system out. Yes, turned out I had leukemia, and the pain was from the bone marrow in my breastbone. I'm a diabetic and had what felt like a blister under my big toe on my right foot. The pain got worse, and I would continue to work and put Neosporin on it for weeks. The day before Thanksgiving break, I decided, the day after Thanksgiving, I'm going to the doctor. Never made it. My sister came over on Thanksgiving, couldn't get an answer from me. Forced herself into my house and found me unconscious in bed. I was rushed to the ER. When I awoke, I was in the hallway of the ER, along several other patients waiting for a room to open up. For hours I laid there with an awful pain and this stench. Finally, the doctor came around with tablet and was going patient to patient assessing, diagnosing the urgency. When she got to me, she lifted the sheet covering my feet and made a face. She asked, "Do you smell that?" I said yes. She informed me I had gangrene, and I was going to lose my foot. "Are you prepared to have the operation today? If you wait, you will lose your leg." I was "Oh, I have Kaiser. Can you transfer me to that hospital, please?" She had me fill out forms releasing that hospital from any liability if I should die from not getting treatment there. A few hours later, I was transported to Kaiser. I was immediately placed in my own room and had about 3 dossiers all checking me out, and one asked me, "Do you feel this?" I looked down, and she had been sticking a needle under my toenail. I said I did not. She then said, "You are going to lose your toe today." I asked, "Not my foot?" She said no. She then asked, "Have you ever had morphine?" I said no, as the nurse was injecting a dose. I instantly felt this overwhelming urge to just lay back. Like ton was sitting on my chest. I knocked out when I awoke. My toe was gone. Not me, but my younger brother. An old lady nurse didn't sanitize, wash, or even wipe down her hands. According to my mother, who was also there, she had crust under her fingernails too. When she went to actually stick the needle in my brother's vein, she didn't even try to check where the vein was and had to keep moving the needle around for like 3 attempts. May not be 100% accurate because I have a bad memory. I have daily chronic pain, but I'm also male and quite young, being late 20s. I've had a few doctors take one look at me, not even listen to the list of previously tried medications or even my symptoms past a lot of pain, and just tell me, "You're too young to be in that much pain. You're just looking for drugs, so get out." A lot of doctors that I've spoken to don't seem to want to bother helping with chronic pain because it's a lot of failures before finding something that works, and it might bruise their ego that they didn't get it right the first time. I've taken myself to the hospital once when I was having the highest level of pain I'd ever felt and was told to take some ibuprofen and lay down. I was dismissed because I'm young, even though I was using my cane and was just about crying out from pain every few seconds. I don't have much faith in the medical system anymore. Ran into a coffee table and busted my lip when I was a toddler. When they performed the surgery, they didn't give me any anesthesia or numbing, so I felt every stitch go through and the pulling of the thread hurt like hell. A few weeks later, they took them out. One night my throat began closing and I felt like I couldn't breathe. I was wheezing so much, and it became so unbearable I had my dad drive me to the ER. They had me wait in the waiting room for 4 hours. I literally felt like my throat was going to close all the way if I didn't get any help soon. Eventually, I began vomiting huge clumps of phlegm in the waiting room. Think about when you cough up a phlegm ball the size/area of a quarter. So this was the same consistency, but the balls of phlegm were like 3 by 5 inches wide. After that, they finally took me back and gave me a chest x-ray and immediately put me on a ventilator. My lungs were filled with mucus and fluid. Was having trouble breathing and went into the ER. Doc told me I was fine, had a cold, and just went home. No x-ray, no check if my lungs with a stethoscope. My temperature wasn't elevated, and since he believed that if you're sick, you'd run a fever, he wouldn't even check me. Next day, I went to see my GP. I had pneumonia. Then there was the clown who accused me of drug-seeking behavior when I came in trying to figure out why my back hurt so badly, and it radiated down my leg. Spoiler, I had a slipped disc which was subsequently removed by another doc, and I have had no issues since. I'm also massively allergic, anaphylactic, to every narcotic I have been given. Ride in the ambulance type allergic, so I wasn't seeking anything but answers. Moron. Got a cold that turned into a bacterial sinus infection the last few weeks before winter break. Back then, I had a deviated septum, so this was a regular occurrence, and I could tell when I was no longer sick from a virus, and it was time for antibiotics. My PCP wasn't available for 2 weeks after I got home from unit for the break, so I went to urgent care and this dumbass refused to listen to me, the person who knows their body, and said it was just a cold and sent me home after charging $120. My insurance didn't have copays for urgent care. I went ahead and set up an appointment with my PCP. When he finally saw me, I'd been sick for 6 weeks, and the infection had spread, and I had walking pneumonia. When I was young, my cousin was throwing bricks behind all of the cars in my yard. We had a lot of open space in the front. I told him to stop and didn't listen, so I told him I was just going to move them, so they threw a rock at me and hit me on the head. I walked inside and my family freaked, 'cause half of my face was covered in blood. I didn't notice, till they said setting, and passed out. I woke up in the car as they were taking me to a hospital, but we couldn't go in, because they didn't take our insurance. So, we went to the next one, but they didn't treat children, so we had to go to the farthest one, and they finally got me in. The doctor that we got thought the nurses gave me a painkiller and went and stapled my skull. Didn't really hurt as bad as I thought, but I think I was due to shock or something, but yes, I almost died crazy times. Was given 3 shots back to back when I had previously mentioned to the nurse that I'd been fasting. Immediately fainted and fell to the floor after standing up. Woke up surrounded by a bunch of doctors and nurses, and when I came to the nurse said, I knew that was going to happen. Immediately after waking up after fainting, they asked if I was ready for my blood test. TPH, as of now this is honestly my worst experience. So, on February 26, 2021, I had eye surgery to fix muscles. Now that went well. But the worst part was what the doctor said to me about the recovery time on the consultation pre-surgery appointment. You'll be back to school Monday, lay down for a couple days, and Monday you'll be back to your normal routine. This quote is similar to what he said, but it does fit it well. Now I'll be honest, this didn't happen. I had a few days of my eye sealing itself shut, then virtual schooling due to personal safety, as that was allowed for my recovery. I was hurt emotionally by the doctor. Thankfully, it's been uneventful since. I was younger, and my doctor was kind of creepy and depressing. We would go there for a simple checkup, and he and my parents would spend 20+ minutes talking about his divorce and how his wife took everything, grimacing face, grimacing face, grimacing face. But the very final time I went to his office, he gave me a physical, and he told me I was overweight for my age, and instead of trying to help me and give me tips on how to lose weight for someone at such a young age, he criticized, scolded, and practically bullied me the whole time. When the last time I checked, he wasn't in the proper weight range for people his age either, so I ended up leaving his office and center, coming back. My coin purse swelled up to the size of a grapefruit and my asthma was really bad. Had a really bad, painful cyst. Doctors accused me of lying about my asthma because they couldn't hear my wheezing, despite the fact that my airways are closing up. Nurses acted indignant that I came in because they had to look at my aforementioned coin purse. Despite the fact that neither of us was having fun, at least she could go pee if she needed to. My urethra was swollen shut. They never bothered with my cyst, despite my loudly talking about it being a major concern. They left me in an exam room for 13 hours with 4 just in my arm after taking 7 vials of blood, and another 4 for blood work that wouldn't produce results until several days after I would have left and looking at the man parts. Then, after 13 uncomfortable hours, they just discharged me. We still think your asthma isn't real, but our lung doctor disagrees, so here's a script for albuterol, even though we said we didn't want to give it to you. As far as making us look at your balls, here's a script for a bag of ice. We aren't looking at the other thing. Bye. I had to do a physical in one of those really flimsy hospital gowns, so I had to squat and kind of waddle across the room. The whole time the gown is like slipping down my body. I almost failed the physical because I kept stopping to fix my gown. If why they made me change into that gown for a stupid physical, but that was legit the worst. Should have been a standard blood test. Doc poked the needle into my arm. Pulled the needle out. Poked my arm again. Pulled the needle out. Poked my arm a third time. This time he kept the needle in and moved it around to find my vein. Finally removed the needle and told me to come back another day. My hair was falling out, chunks and chunks of it, and every single doctor I visited told me it was due to stress. It took me 4 years to find a doctor who actually listened and took me seriously. Turns out I have a form of alopecia. I had to go to a pre-op appointment for a surgery I was having, and I didn't think I'd have to give blood there. As soon as they called me in, they told me to pee in a cup and then they were going to take my blood. I have a huge phobia of needles and getting blood drawn, and I literally started panicking. I was almost running around the room and was trying to escape. It didn't help that the woman wasn't being too empathetic. She was just kind of laughing at me, saying I had nothing to be scared about. I laid down and somehow got through it. Almost passed out after though. Talking to my doctor about my depression, and he tells me I should go to church. I tell him I spent the first 20-something years of my life in the church and it's not for me anymore. Man then tells me to try again and actually put some effort in this time. I spent my life in church. I didn't just go on Sundays, every once in a while, or during holidays. I was there multiple times a week, went to every retreat, volunteered for outreach, etc. To be told I should go back to something I no longer felt comfortable being a part of or even believing in, and to actually put effort in this time made me livid. Never went back to that doctor. Still haven't gone back to church either. I was going through a rough time health-wise with a mystery illness which turned out to be acute viral hepatitis in my early 20s, and since I was scared and experiencing a ton of anxiety, my mom started coming to appointments with me. Here's where it gets weird. One day I started seeing blood in my poo. Since I'm already on high alert, I book an appointment and my mom and I head to the doctor. During the appointment, he has me get on the exam table on all fours, lubes up his fingers, and gives me a digits exam up the butt directly in front of my mom, who is very traditional. It was such a weird moment. We made eye contact during it but never spoke about it, not on the car ride home, not ever. I had a terrible doctor who was religious and wouldn't treat me for anything. Had sleep problems. Nope. Threw my back out for 6 months. Nothing. Not even a referral to PT or anything. Had a kidney infection. You must be drug seeking again. I found a new doctor and she's amazing. I've been seeing her for 3 years now and she's helped me so much through blood work and finding and treating my issues and listening to me. I was able to get my mental health under control, get my sleep under control, and start going to the gym and drinking less. I'm not taking any medication and I'm happier with my life than I've ever been. When I was about 21 years old, I started having blood in my stool. I went to a nurse practitioner about the issue. She suggested I start taking fiber every day because the blood was probably from a hemorrhoid. This was our 2 on Thanksgiving, as I have home for the holiday break from college. Over the next month, my symptoms got worse. I lost 20 pounds, and a night or two before Christmas, I ended up going to the emergency room. I was later diagnosed with Crohn's disease. While it would have been uncomfortable, a lot of pain probably could have been avoided if the NP did some sort of exam during our visit, rather than just assuming it was a hemorrhoid. Granted, I was a relatively healthy guy at the time, but still. That month after my visit with her was the worst I had ever felt in my life. Prescribed ciprofloxacin for a UTI against FDA guidelines, because Cipro is actually a pretty dangerous drug to mess around with, and there are much safer drugs to use for trivial infections. Turns out the UTI never even existed in the first place. I now have permanent joint and nerve pain throughout my body, among other issues. When pressed and presented with the official FDA article outlining the dangerous side effects and the appropriate use of the drug, his only response was, "You can't believe everything you read on the internet." Proceeds to cite empirical evidence to prove that the drug is perfectly safe, and brags that he's prescribed it thousands of times throughout his career. It took almost a year and 5 different doctors for someone to stop saying that my symptoms, 1 year without my period, weight gain, mood swings, lactation, etc., were normal for a woman, or because I'm fat and I get the diagnosis of pituitary tumor. Luckily for me it was benign, and it was just beginning, so I was able to treat it quickly, and today I'm better. But it was really frustrating. Oh, and once I had to go to a neurologist to renew my prescription for antidepressants and anti-anxiety drugs, because in the city where I was there was only one psychiatrist, small town, and he was on vacation. The neurologist told me I was spoiled with a weak mind and should be more grateful to my parents than complaining about them. He simply ignored the abuse I suffered at the hands of my mother, the neglect of my father, and the fact that I was harassed by a childhood friend of my parents who was super close and present in my life. I almost gave up on everything that day. Had to get blood taken one time. I had been told in the past I have very good veins. This time the gal tried stabbing me 4 times in the arm, 2 in the back of the hand, before giving up and asking a more experienced nurse, came in and had it handled in a few seconds. Well, except the times I was told if I lost weight, then whatever problem I was having would go away, was told that for bad sleep, depression, anxiety, didn't help. It was with doctors when I was in the military. I had really bad diarrhea where I was pooping every 10 minutes and really dehydrated. I still had to go into work. I couldn't believe it. I thought about it and decided against it because I only have so many pairs of underwear, you know? I was just being an idiot at work and cut my arm with a high-quality knife I bought and had to get about 7 stitches, and for the entire time I was sitting up and held my arm in an uncomfortable position for about 30 minutes. The first bit of time before the doctor that did my stitches came in, so many nurses and other people were looking at my open wounds because it was so late, and my parents took me somewhere close, so it wasn't a full hospital. It's whether to say it is multiple, because it made a little V shape, and they are not connected. Sorry for the long comment. I have a legitimate medical phobia. So much so, that I've been in therapy for years about it, and nearly any time I have blood drawn, discuss medical topics, etc., I will pass out. It used to be so bad that I'd avoid going altogether. That being said, one time I was experiencing some pain on the right side of my testicles that radiated up through the side of my groin. I tried to ignore it for a couple of days, but the pain worsened, and I decided to face the situation and go to the hospital. Upon entering, I warned the intake person that I am very prone to fainting and to not be too alarmed if it were to happen. I then explain my symptoms to her, and she says, "You may have a testicular torsion, we need to get you into the ER immediately." Naturally, I promptly pass out from terror and wake up rushed on a gurney. They thought I'd fainted for a medical reason, but I had to quickly snap to and explain it was just my insane medical phobia. I'm led into the ER, assuring the staff that I'm fine and am just very scared. They then took my blood. So, once again, I pass out and wake up like 30 seconds later. They're a little less concerned, but are still on high alert. Then they stick an 4 in me. I passed out a third, and final, time. At this point, I was exhausted, anxious, ashamed, frustrated, and my balls were still hurting like hell. The doctor finally rolls in. Clipboard in hand. He takes a look at me and says, "So, I hear you're a bit of a pansy." The salt in the wound cast upon me by this doctor was unwelcome. Anyway, it turned out to be some residual scraping from a small kidney stone that I'd already passed, for which they gave me Flomax. Flomax causes retrograde ejaculation, which I was not warned about whatsoever. So, after some days of healing, I masturbated and upon climax, literally nothing came out of my penis. I started panicking, stood up in my room and once again passed it out. It was a long week. So, when I was like 12, we discovered a mole on my head. It was quite big, so we wanted to check if it was cancerous. Mom took me to a doctor who will take a sample. The doctor brings out local anesthesia because she will cut into it. Manages to set the needle wrong, so the anesthesia doesn't work. Cuts into my head. Manages to cut a vein. Cue like 30 minutes of bleeding. Doctor freaked out. Mom had to put pressure on the cut to stop the bleeding. I was in pain and scared. Worst part? The doctor didn't get a good sample, so it was all wasted. Went in later, to a different doctor, and got surgery to get the mole removed. My first appointment with a new doctor. She called me a liar multiple times after being asking if I smoked or did any drugs. I wasn't lying. She just didn't believe me. I was pretty much crying for the rest of the interrogation and ended up switching to a much nicer/trusting doctor within the week. I've never had an experience like it before or after. It was super unprofessional looking back. It was a long time ago, so I can't remember why I was there, but I was telling him about the symptoms I was having. The computer in the exam room was set in a way that only the doctor could see it. I managed to get a glance and saw that he was looking up my symptoms on WebMD. I switched doctors shortly after. Happened when I was caring for my dear old dad. The doctor told me that a scan had shown that he had an inoperable brain tumor and did not long to live. I sat Dad down and explained this gently to him, knowing that he'd forget, and I'd have to do it again in a few days. Took him to hospital for some more tests. Turns out, not a brain tumor at all, just your average vascular dementia for his age. I had no idea where they had come up with the tumor. Excellent job, he forgot about it in the car on the way home. At the dentist, before the hygienist begins the cleaning, they will usually chart your teeth one by one, i.e., measure the gum line, and will call out numbers. 1 to 3 is fine, but anything above usually requires some intervention to get back to a 3. Don't ask me why, but I always get nervous with charts. It feels like I'm being graded on which kind of is. I had been going through a divorce and was all around depressed when I went in to get my teeth cleaned. I chatted a few 4s and 5s, and as soon as they were done the hygienist turned to me and started asking what's going on. I looked at her and burst into tears. I was so embarrassed and low-key mad at her, but she was simply confused, and they let me sit in the chair by myself to cry. I always asked for a different hygienist moving forward. I had a cyst under the skin on my back. Was deep and apparently attached to muscle or something. Every move hit like crazy. Had a ton of meds to take to reduce infection so they could do surgery. Seeing several doctors during the month and a half of this BS, one was a female PA physician assistant. She decided to give it a good squeeze during an exam to see if she could empty it, I guess. Nearly killed me as I dropped to my knees. Then she looked at my blood work and said I was in kidney and heart failure. She killed me and I was dying. Mum. Nope. All the meds just whacked out my numbers. Had surgery, felt better immediately, 10 days later, and I'm under my deck doing electrical work feeling normal and no kidney or heart issues. Won't see that PA again. Got in a motorcycle accident. Ruptured 4 discs in my backdrop foot, the whole thing. The ER dry said they were busy, and I was having spasms and to just go home. The pain was so insane I couldn't move 1 inch. I'd pass out, then come back to the pain. My son finally grabbed the dry and asked if he was screaming something was wrong. After the Ms., they were like, "Pooh, my bad." Sought treatment for ear issues, paint, and reduced hearing. I am a Swede, in Sweden, but got a Danish doctor. Technically Danish and Swedish is so closely related you should be able to understand. In practice that isn't true. I much rather have a proper immigrant that actually bothered to learn the language. Had a CT scanned with contrast dye for my kidney in the morning and ended up having an allergic reaction to something as well as kidney pain the same day and ended up at hospital in the middle of the night due to it. The first doc I saw, and the nurses all agreed the allergic reaction was due to the contrast dye, and I was not sure about why I am in pain. Few hours later, which was in the middle of the night, a different doctor comes in and tells me he wants to do CT scan with dye to see what's going on because they didn't have the scan report from earlier that day. I tell him about the reaction I had, but he dismissed it saying, "Can't be sure that the dye was the cause of the reaction and they need to see what's going on, and the dye was the only way." I ended up agreeing only because I felt pressured into it, and sure enough, a few hours after it my entire body turned red and hot. I ended up calling the hospital when I got home because I wasn't happy about being pressured into the scan with the dye, and they agreed that it shouldn't have been done, and that doctor ignored the allergy alert in my notes when he came to speak to me. Took a few days for the rash to fade, but then I started getting major hive flare-ups all over my body, as well as lip/eye swelling a couple times a week, and then severe anaphylaxis to ibuprofen. The hive flare-ups went on almost every single day for almost 2 years. The only time I didn't get a flare-up was when I got in a new med, but they only worked for a few weeks on and off. Surprise prostate exam. I went in to get some hemorrhoid cream. That was it. I knew what it was, but the cream was $6 at the PX. I could get it free at sick bay, and a day or two off from PT doc told me to turn around and bend over. WTF? Sick doctor. "I'm going to check your prostate, you may feel a little pressure," and he slammed his finger and started rooting around. That was the first time I got demoted. Bad Navy docs. Not sure about the worst. But the most awkward was when I went to a hospital's imaging department for an external/internal ultrasound to look for ovarian cysts. Turns out that I-23F was having an ultrasound wand put inside me, down there, by a 6 feet 4'm", 25, ultrasound technician. It was horrible. When I had a pilonidal cyst removed, I had to go to my closest hospital's wound care center at my surgeon's suggestion. So, I go there, they ask me to strip, and I lay down on my stomach. 10 minutes later, I have at least four nurses spreading me as cheeks open and prodding my 6th orifice, while I'm crying in pain and asking them to stop. Even worse, my mother, who was in the room, just gave half-hearted "It's all right, don't worry, calm down" reassurances. Like, "Lady, I'm having a panic attack, can you try and give it one tries? Just one?" Finally, they stop. Gauze is stuffed in the hole. And I'm left unable to walk due to the immense pain. I had to be wheeled out in a wheelchair and be completely embarrassed because, oh look, here's the morbidly obese teenager in a wheelchair, guess she can't walk 'cause she's so fat, what a shame. I remember crying my eyes out in the hallway between the 2 double-door entrances, and some lady passing by stopped and asked if I was all right and if I needed help. My brain frazzled, I told her I was fine, and I didn't need help. The worst thing is, my mother decided to remedy my panic attack, my traumatizing appointment, by taking me to McDonald's. Which did not help at all. To this day, I avoid that hospital like the plague. That appointment was my first panic attack since being diagnosed with an anxiety disorder when I was a kid. And I haven't had a futon of doctors on me since I was a kid and had to get blood drawn. I despise needles and need lidocaine applied on my skin in order to get them. Never again. My sister got a thorn in her foot. It broke off a few millimeters below the skin, and my parents had to take her to 3 doctors who all said, "No, it's too complicated. She needs surgery." Before they took her to the ER, where a nurse pulled it out with tweezers and a tool to hold the skin back. When I went to hospital for vaginal bleeding lasting over 6 months, without examining me said, "Oh, you're obese, it's prob cervical cancer, as your obesity makes it high risk." Well, I'll examine you, but I trust my own diagnosis of trust like a chicken. Things inside me like torture devices. He takes a piece of my womb. "Oh, it's just thickened, but you will get cancer, unless you diet, go down to 500 calls a day, move more." I had anemia as well, and that was 15 years ago. Now I'm terrified I'll get cancer. I mean, even if I do, what a thing to say to a young person already scared to death, and I have slipped 2 discs and back dodged, and can hardly move, as well as hyperthyroidism and Cushing's disease. It like I'm doomed. I had 2 dental implants done at the same time on teeth that had failed root canals. Because of the root canal, the teeth become brittle and can't be pulled. They took a hammer, and a punch broke up the teeth before pulling out the pieces. I was numbed up really good, thank you Mr. Dentist, but the sound of the hammering stuck with me for a while. 2 days later, I woke up with a bad stomachache. I tried going to work, but it hurt too much, so I went to the doctor. I ended up having appendicitis. For some reason, the nurses kept having a tough time finding my veins. I got stuck over a dozen times. One nurse hit a valve in my vein, and that hurt like hell. After the surgery, my mouth was sore because of the fresh implants and the breathing tube. When I was around 11, I got kicked in the face by a horse. Chipped my tooth, so I went to the dentist to have it repaired. The doctor came up behind me and neighed in my ear, which really creeped me out. Then when he was examining me, he literally admitted to driving a boat while drunk and crashing because of it. That's why his teeth were chipped as well. Never went back there. I have had digestion issues since I was 2, but when I was 11 years old, it started getting a lot more serious, to the point where I'm always bloated every time I eat, have zero appetite, and sometimes wake up in the middle of the night to throw up when I eat certain foods, sugar, too much fat, white flour, etc., so I wasn't allowed to eat ice cream and still haven't to this day. I lost 12 pounds in 6 months, and my mom took me to the children's hospital. There I found out I was very underweight and had malnutrition. After doing a test for celiac disease and testing my kidneys, they claimed that they don't know what's wrong with me. I mean, they literally just tell me that I made up all this sickness in my mind after I tested negative in 2 tests. Hello, there are thousands of digestive diseases. The team of doctors said that they know I want to eat junk food that makes me throw up, but they still diagnosed me with unspecified eating disorder. Here's where it gets worse. An 11-year-old sick girl, me, was put on an emergency eating disorder weight gain plan. They forced me into a 2,800-calorie diet, full of everything that makes me sick. The foods are the same and repeated continuously. For example, 6 bananas a day, 8 cups of milk every day, etc. I was forced to finish everything. Every last drop of salad dressing. 2. I was stared at by nurses while I eat, so they make sure I don't hide food or throw them away. Was forced to finish everything within 30 minutes, eat every 2 hours, not allowed to go to the bathroom after eating for 1 hour. They think I'll make myself throw up. And even if I did go to the bathroom, I had to notify a nurse to come. My door had to be half open, with the nurse just outside the door. 3. I wasn't allowed to move at all. For those of you that have experienced overeating, we all know that walking it off helps. Well, I wasn't even allowed to stand for more than 3 minutes beside my bed because they'd believe I'll faint, as well as burning calories. Not even stretching. It's either sitting or lying on my bed. 4. The doctor team woke up at 6 every day to draw blood and take my blood sugar. It would have been better if they didn't promise me they'd stop after 3 days. 5. They don't listen to me. Granted, I was 11, but I tried to use facts and spoke professionally. But it's hard to win an argument against a whole team of doctors. They tried to convince me I have an eating disorder. They increased my food intake even when I begged them to decrease it. I asked them politely to give me lactose-free milk, which they said they did, but forgot 3 times. I asked for whole wheat bread for easier digestion, and no, they still give me buttered chewy white bread. The team of doctors only came once a day, and I really tried my best, but nothing worked. They treated me like a toddler throwing a tantrum even though I was polite and calm. It's been years now, and I still have trouble trusting doctors and having an emotional relationship with food. My mom beloved the concept of me having an eating disorder. During the painful process of my weight gain journey, I have extremely high metabolism and am still bloated. We had lots of arguments. Our relationship is now broken. To them, this is just another sick child, but they have no idea how much they ruined my life to the point where I considered suicide. I flinch when I hear the word eating disorder, healing from depression, and my close relationship with my mom now has a wall between it. I'm crying now writing this, and if there's anyone here who has digestion syndromes or has been accused of having an eating disorder, please share your story with me. Doctor gave my 4MO son a vaccine that we specifically told them we didn't want. He did anyway, and turns out it's a vaccine that has not been tested safely enough to be approved for his age. He was having an allergic reaction all week, but told me it was just a virus after I kept bringing him in. They finally realized their mistake and didn't apologize or anything and lied about so much to cover their butts from a lawsuit. This was last week. I'm still looking into pressing charges. Had pneumonia, got stuck in the hospital for 3 weeks. Had a chest tube through my side without anesthetic. Blacked out in the shower and broke 2 of my teeth. Discovered I was allergic to penicillin. It wasn't a fun time. I was there for a physical, just the basic stuff going down, casual questions, and then she asked if I wanted my mom in the room with us or not. I was confused, as it was just that simple question, so I say what and she repeats, do you want your mom in or out? I say out, and she has my mom exit. At this point, she just tells me to lay back and I have no idea what's going on or why she needs my mom out. She then rips up my shirt and my bra and starts feeling away as I'm completely caught off guard as to what just happened and why her hands are on me. I get that doctors have to check for lumps and other concerning things, but a warning about it or walk through about whatever was going on would have been nice. I say no to being checked now. Makes me extremely uncomfortable. A doctor came to the conclusion that I had some heart disease since I had a really nasty cough. Turns out it was just a normal cough. He was going to put me on heart medications, who knows what that would have done. This was over 2 decades ago when I was a kid. The area around my ear became painfully swollen. By the time my wife and I had the time to schedule a checkup, the pain was already gone and only a little bit of swelling was left, but I decided to continue with the appointment so I could at least find out what happened and avoid the experience in the future. Ear doctor refused to listen, told me he didn't care how it happened, only that he can prescribe drugs to alleviate my discomfort. As an introvert, I went quiet after that, and my wife spoke for me about the rest of that horrible checkup. We didn't buy the medicine. Didn't need it. I was dismissed from the emergency room 3 times because the lady operating the ultrasound thought that the massive cyst wrapped around my ovaries was my bladder. She told me to go pee because my bladder is full, and even after that she just shamed me that I didn't pee properly and sent me away. I would not have received treatment if it weren't for my mom and my aunt who knew a surgeon and insisted they are doing an investigative surgery. It turns out I had a cyst the size of a grape. It had partially busted, leaked inside me, and wrapped around one of the tubes. I had been living a week with half of my ovaries in necrosis. I was 16. I think the surgeon had been furious about it, since when I woke up there were a lot of staff there looking very ashamed when he explained to me that he had found it. I heard someone explain themselves with "you just didn't seem to be in that much pain." My trust in healthcare collapsed, and after that I made sure to exaggerate everything. Broke both my arms falling down from a scaffolding at work. The nurses tried to force me to take my shirt off by myself. Couldn't do it and kept asking them just to cut it off. Eventually, they pulled my shirt off me while I was howling out of pain. When I came back from X-ray, both nurses were waiting for me and gave me a little apology. The radius bone had snapped in both arms. Was playing tag in my old apartment with my younger brother, hit my head on the corner of a workbench island thing. I went to hospital and had to have stitches, but I was so shocked that the thing that was meant to relax you or put you to sleep didn't work, so I was awake and fidgety while they did them. I didn't enjoy it and came out of the hospital in tears. I was 4. I was really young, like around 7 to 8. I have epilepsy caused by anxiety. I woke up one morning because I had a raging headache. So, I did what I normally do, go to the bathroom and watch TV until my parents woke up. Well, that got cut short. I went into the bathroom, peed, looked at myself in the mirror, and I fell. Hit my head on the semi-closed door that had now shut itself, and my moms were unable to open it because I was seizing in front of it. Now, one thing about my epilepsy is that I throw up after every seizure. So, I came back to my mom slipping her fingers under the door, caressing my head, and calling my name, trying to get me conscious again, which worked, and then bam, I rushed to the toilet and started vomiting my guts out. Normally I seize once, and it passes. So, I go lay down on the couch, I watch TV, and would you guess it, I seize again. My mom decided that I should probably go to the hospital, so she called an ambulance. They come in and they don't believe me or my parents, but they take me with them either way. Well, little did they know I seized a third time in the time span of 20 minutes. Now the EMTs finally believed me. I got to the hospital and boom, other seizure. So that was now 4 seizures in 30 to 35 minutes. I got a CT scan, and yes, that's pretty much it. I ended up leaving 3 seizures later and with Keppra that I had to take every morning and every night for 2 years. My mom took me there when I was younger and asked for a little medical slip to take to be able to get to a therapist because I was self-harming and really depressed. The doctor, no joke, told me to just smile more and refused to give us the form.
I had a lump between my testicles. Went to my doctor and she didn't examine me, but she issued a referral. The referral ended up being to an STD clinic, which I really didn't need. Had to go back and ask to see a specific doctor who would examine me, then I got referred to have a scan. Everything was fine, but the process was extended by a month due to the doctor not examining me. It was really unnecessary and a little bit stressful. Not me, but my mom had a hernia after having emergency surgery to remove part of her randomly dead intestines, and the doctor advised her that she needed to lose weight before they would do the surgery. She hasn't managed to lose weight over the last several years, so her hernia has just gotten insanely worse, and she's afraid to even go back to have them fix it because she thinks she'll be told they won't because of her weight. I don't know how old I was, but according to my parents I was 4. I had a constant fluid buildup behind my eardrums, so I needed some sort of surgery in my ears. Don't ask what it's called, because I can't remember. As clear as day I can remember a person brought in while screaming with his arm looking like it was mauled by a bear. I don't think my parents knew I saw the man because they told me something about a movie in the waiting room. When I asked my dad 15 years later, he was surprised I even remembered, but told me that the man's arm got into a lathe while he was working on it. At least my aunt gave me a Sprite after the operation. When I nearly died, they gave me penicillin knowing I was allergic. I went into anaphylaxis, I couldn't breathe, and my left lung collapsed. They tried to reverse what they had done and made things a lot worse. My lungs started to fail as well as other organs. I spent 1 whole month in intensive care. I was hooked up to all the different machines to keep me alive. It was awful. I wouldn't wish it on my worst enemy. 7th grade mandatory health check. So, you like being fat, air, while holding my testicles on a spoon, descent test. Destroyed my self-confidence for years, maybe even for decades. I stopped taking care of myself and hated my image in mirrors. Had no such problems before. To that doctor, if I could slap them repeatedly. The moment he chose to say it, the situation being super embarrassing already, the callous way he said it. And I was not fat, I was a bit overweight, but after that, I did get fatter. When you just start going to school, 6 years old, you go to a doc to check you out. Well, you see, those of my friends looked at me and didn't spot that one of my legs was shorter than the other one, that I had flat feet, and that I had mild scoliosis. I was suffering from 2 herniated discs in my lower back that were misdiagnosed in high school. I was told I had tendinitis in my hip and there was nothing I could do. It wasn't until I was in my third year of college that I went to a new primary school, and they said, "That doesn't sound like tendinitis, that sounds like a herniated disc." Anyway, that's not the situation. Fast forward a few years. I am working, and my back is just trash. Finally breaks down and sees an orthopedic, and he wants to do a cortisone shot. Cool, I am down. I talked to the front desk and made the appointment for the next week. Next week comes, I show up. I sat in the waiting room for at least 1.5 hours in what felt like the most uncomfortable chair you could imagine. They finally take me back to the room, where I sit another hour on that paper-covered bench thingies in all the doctor offices. Doctor finally comes in, poke my spine a few times, then asks why I am there. I say I am there for a shot, to which he replies, "We don't do those here." WTF. Like I not only waited hours, but I am in stupid pain now from sitting in a chair followed by a bench, but your front desk made me an appointment for nothing? So, he tells me to talk to the front desk. Fine, whatever. At this point I just want to get the appointment situation fixed so I can go home and lay in bed with ice/heat on my back. This lady at the front desk tells me I owe them a copay. I say for what? For sitting in your chairs only to find out you made the wrong appointment? She basically told me I can't leave without paying. After arguing for several minutes, the dry finally comes out and asks what's going on. I tell him there is no way I am paying a copay to sit in your waiting room. He reaches into his pocket, pulls out $35 and tells the desk lady to let me go home. I am 99% that was fraud, as the appointment was basically me waiting followed by him telling me they made me the wrong appointment. But at that point I was in so much pain I honestly didn't care. I just wanted to go home and lay down.